Is infliximab safe during pregnancy? Have you ever wondered about the safety of medications during pregnancy, especially for those managing inflammatory bowel diseases? Today, we will discuss infliximab and its use during pregnancy. Infliximab is a biologic medication that treats conditions like Crohn's disease and ulcerative colitis. It is important to know how this medication affects both the mother and the baby during pregnancy. Maintaining remission from inflammatory bowel disease during pregnancy is vital. Active disease can lead to complications such as preterm birth and low birth weight. Therefore, continuing effective treatment is essential for both maternal and fetal health. Infliximab works by blocking tumor necrosis factor alpha, a substance that contributes to inflammation. One key point to note is that infliximab can cross the placenta, especially in the later stages of pregnancy. It can even be found in the infant's bloodstream for several months after birth. However, studies involving hundreds of pregnancies have shown that there is no significant increase in risks such as miscarriage or congenital abnormalities for infants exposed to infliximab in utero. Research indicates that pregnancy outcomes are similar for women receiving either the original infliximab or its biosimilar versions. Infants exposed to infliximab during pregnancy do not show an increased risk of infections or issues with vaccine responses. Some healthcare providers recommend stopping infliximab infusions around 32 to 30 for weeks of pregnancy. This is done to reduce the infant's exposure to the medication at birth, but the decision can vary based on individual circumstances and disease activity. For those with sensitive stomach conditions like irritable bowel syndrome and colitis, understanding the safety profile of infliximab during pregnancy is important. While infliximab is primarily used for inflammatory bowel disease, its safety during pregnancy supports its use to manage inflammation. Uncontrolled inflammation can worsen symptoms and lead to complications, so maintaining treatment can help manage sensitive gut conditions during this time. In summary, infliximab is generally considered safe during pregnancy for women with inflammatory bowel disease, including those with colitis. It is essential to use it under medical supervision to maintain disease remission. This approach helps protect both the mother's health and the developing baby, minimizing risks associated with active disease.